Right.
Okay. As you notice, Jackie's wearing a mask. We've had a spike in our county, significant, like hugely.
Yep.
And the reason I'm wearing a mask is because we're in close proximity in a closed room. So I'm gonna recommend that any gathering, period, you wear a mask. And that includes in your family. And the reason is that's where we're getting it. We're not
Did you
getting it
turn
at
back
Walmart.
on?
Yes. We are getting it at our family get-togethers. Kids are getting it at sleepovers. They're not getting it at school.
Right.
That's not where we're seeing our transmission, and that's not just Osage County. Shawnee County's public health officer just put out some data that supports that, and he says, here's where we had our spike, here's where kids went back to school rather than remote, here's where they started their sports, here's where they start, and they don't line up.
Mm-hmm.
So it's not the schools where the transmission is occurring. They're wearing masks, and that's great. We still have that whole, both of you wear a mask, you don't have to quarantine, we'll still do that. Our numbers. So this was from the 5th, which was the last time we put out numbers on social media. I was on vacation last week, and so was Tim, and so that put us back, but at the time we took our vacation, we didn't have this. This just, boom, this just happened. So we've gone from active positives of 25 to active positives at this particular point of 120. So it jumped significantly. That's huge. Our total numbers, and that's what's active and what has recovered, our count is 311. KDHE's count is 306. That is as of Friday. They have not updated their Monday numbers yet. Our numbers are never going to match.
Yeah.
And we actually have looked into, because the numbers are extremely difficult to reconcile and to get even our numbers to match from day to day, we're probably going to start using more of the state's data, because for us to count them all individually and reconcile them for who's actually positive, who has recovered, who is quarantined, who is negative, huge undertaking.
Yes.
Just a little bit of insight so you know how we get our information, and this is for everybody. When KDHE puts information that we get in an email every day, and it gives us a list of all the people who have been tested. And that includes everything that goes into the EpiTrack system. That doesn't just include coronavirus. That includes blood lead testing, so if we have a blood lead, that comes out in that. That includes any other communicable disease that is reportable, such as chlamydia, anything.
Right,
And
okay.
there's, we don't get a ton of them, but they're still in there.
Mhm.
So
Right.
that has to be subtracted. On top of that, when we get the information, it gives us a number, only a number. It gives us what disease was tested for, the date, and the result. So then we have to go into EpiTracks and look and see if that number and that person and that address are actually in our county. And sometimes they're not.
Right.
So we discount them, but the state does not. We've tried calling them multiple times, and they're overwhelmed too.
Yes.
So they're not taking it out of their system. All they do is they go in, they do a report on the state and get their numbers. They don't go back and reconcile anything, that shouldn't be here, that shouldn't be there, all that. They do, of course, discount the other diseases. They don't put those in there. It's just COVID. But I'm just trying to give people an idea of
Right.
how hard it is to keep our numbers,
Right.
and to make sure everybody knows that we are not trying to hide anything. We are trying to do as accurate as we can. We're only reporting the positive PCR tests. If they're a positive antigen test, we do not report that as a positive, and we're not supposed to. We call them and we treat them like they're positive, and if they want to go get a PCR, and if they can, right now it's hard, then we can do that. But otherwise, they're not counted in our count.
There isn't a lot of difference though between the two numbers, are there?
In what two
What the
numbers?
state is and what you had.
Right now, it's not. But when they come out with their numbers today, they come out at 12:30, it may be different. You know, right now they have 306, we have 311, from Friday to Monday. I know for a fact there was at least 5 just yesterday. And
And then
so,
the higher we get in the count, the more negligible it becomes.
Right.
That
Yeah.
drops down
some other things about the numbers, are hospitalized right now, is really hard to count. We've been reporting it. I don't think we're going to anymore, and the reason is, we can't say what they're hospitalized for. We don't know. We know for a fact that we've had several people hospitalized that have COVID that were not hospitalized because they have COVID. They were hospitalized for someone else, something else. Maybe they had an underlying condition, and,
Right,
you know, COVID had nothing to do with it.
right.
Some of them, they have an underlying condition and they go to the hospital and then they find out they're positive.
we have one in the hospital that has a broken leg.
Right.
That also has COVID?
Yes.
Yeah.
So we're not gonna report hospitalizations anymore. We don't feel like it really reflects active or accurate data when it comes to COVID. So we're just not gonna report it. Deaths, we will report as well as we can. Right now, we have a confirmed 6, so there's been one more since a little over a week ago. And again, when it comes to deaths, if it's listed in the vital statistics, in the Office of Vital Statistics as having COVID on the death certificate, then we have to report it as a COVID death. It doesn't mean that that is the only reason they died. They could have had underlying conditions, but we can't report that. It's nobody else's business, first off, but second off, that really doesn't matter. As far as vital statistics is concerned, they had COVID at the time of their death. It's listed on the certificate in one of the 3 that is listed as a cause, and so then it's counted. So that's how we count the deaths. Just to give you an idea of where we're going with this, most counties that are having these surges are having trouble keeping up with things.
Yep.
Right now, we are able to keep up, but I don't know how much longer if we continue to have a huge surge. I expect this to get bigger, and the reason is because it's what it does. It's a virus that's going to grow exponentially, and the way that it is transmitted, when we go into the cold weather and we're coming into the holidays and people gathering together in small areas is why we're getting transmission. That's why we're seeing the spike, and that's why it's going to continue to go up. So Thanksgiving and Christmas, people will gather and they will get sick. It's the same with flu season. It's just that this is different because we've never had COVID before. Our bodies don't know how to fight it off. We don't have a vaccine. So it's not an unexpected thing, but it is going to be a surge. It's going to be overwhelming. We will do everything we can to keep up as much as we can. If we have to back down on anything, it'll be notifying quarantines. We may have to switch to where quarantines are notified by their positives, which that's being done in several counties and has been for some time. And if we do that, then quarantines will have to call us if they need a letter for their work. And then we would go and verify it as best we can, and make sure that they actually, are supposed to be quarantined. But that, if we have to back off of something, that will be something that you'll see. So just to give you a heads up on that.
What's the current quarantine approximation number? I mean,
I don't even have it.
I would assume significantly higher
Yes.
than it's been.
It is, it's significantly higher. And that's where we get tripped up. Because right now, we have to notify the positive and send them a letter. And then they tell us, if they even know, their list of quarantines. And that can be significant. If they were at a party and there was 100 people there, we have to call 100 people and send them a letter. And I'm gonna tell you right now, she just ordered almost $400 worth of stamps, and she didn't know if that was gonna be enough,
Just for the last batch.
just for sending letters out for
Right.
quarantines and positive, that's it. So, I mean, it's a lot.
Yep.
And envelopes, and we just had to order more files, cause every single person gets a chart. And so, we're going through boxes
So should we be going back and like removing chairs in here and, going back to like we did in the spring?
I would,
Should we
I would
do
re- I would
temperature
recommend
checks
that.
back
No,
at
I
the
don't think
courthouse?
temperature checks are gonna do a damn bit of good.
You don't think that's a thing of the past?
I don't think they do any good. I just don't.
Yep.
I mean, people may have a fever and they may not. Mandates, in my opinion, don't work. So I see the best thing we can do is make our recommendations, educate our people, get the information out there. But we talked about this morning. Should we do a mass gathering limit? Well, it sounds good, but you can't enforce it.
Right.
It's like the
So-
mask mandate, but you
Exactly.
can't enforce it, and so I hate having anything that's, and
Well,
plus
and
it's
the
a
thing is-
mandate, it isn't a law.
The thing is, so if you mandate masks, where are you going to enforce that?
Yeah.
You're gonna enforce it here, because you can.
Right.
You can say, you can't come in here unless you have a
Right.
mask. You can enforce it at Dollar General. They can say,
Our business can,
A
Exactly.
yes.
business can do anything they
Exactly.
want
Right.
to, and I'm all for that.
but the
yes.
problem is that's not where people are getting sick.
Right,
They are not coming to the courthouse, doing their business and leaving and getting sick. That's not where they get it. What they're doing is somebody in the courthouse that works here, even if they're wearing a mask, brings it, sits next to the same people every day,
Right.
every week, in the same room. That's where you get some transmission, if you even get it there. Where you really are getting it is at family gatherings and parties, things like that. Inside, where they're in close proximity for a significant amount of time. With our quarantines, and granted, it's harder to keep up with it now, but I have support of other health departments that are saying the same thing. Their quarantines that are turning up positive are household contacts or family. They are not so much, I haven't gone anywhere but Walmart. That's not really where it comes, unless they've had somebody come in. So I don't feel like mandating anything is going to do us much good, other than increasing my call volume for hate mail.
Yeah.
yeah, right, we understand.
We already get enough of that, thank you very much.
Okay,
So it's more my opinion that we need to do the best we can to educate and to strongly recommend and discourage people from getting together, including Thanksgiving. My family isn't getting together, it sucks. I have a niece getting married. She has a bridal shower coming up in 2 weeks. Probably not gonna get to go, it's in Sabetha with a bunch of people that I'm not usually around. But I have to think about somebody other than myself, and so we're trying to mitigate some things. So that's kind of where we're at, it's just trying to continue and think about it more, because with it, when it being cold, we're not going outside. Our activities aren't outside, our activities are inside, all of them.
Yep.
And that's an increased risk. So those are just some things to think about. I don't think I missed anything. Do you guys have questions?
I would personally like to thank you and everyone that works at the health department for all your efforts, and
Those girls have
you girls have all just
busted
worked
their
and worked every
butts.
weekend and on nights and everything, and I salute all of
I
you,
mean,
and that's all
we were
I can
off this
do,
week,
and I
but we
salute you.
still, took
Yep.
Right.
calls, we still did emails, we still did,
Yep.
and that's okay. It's what we're supposed to do right now.
Yep.
But it's definitely not easy.
Well, I want to give you all attaboys every chance I
Right.
can.
High five in the air.
Attagirls, attaboys, however you want it, but thank you from all of us
Sure.
here.
And
for
I
all you
appreciate
do.
the support. I mean, there's been a lot of counties that have just done nothing but butt heads.
Yes.
And it's very much appreciated that I feel like we can work
Right,
together and
okay.
have done well with that. That helps a lot.
And it doesn't do any good to fight over stuff like this.
schools on indoor sports now, basketball and
They have.
they have seating X's on the bleachers and stuff, you sitting
A
on
lot of
that.
them are doing that. They're following the guidelines that the athletic association, the
Okay.
state athletic association has put out. And those guidelines.
That's still their guidelines though.
That's what I've been putting at them. If they call me with specific questions, I work with them.
Okay,
I've had specific questions about modified quarantine within the schools, which that is one of the things that's in the guidelines that they put out 6 months ago.
okay,
It was one that we didn't approach at the time to develop plans for, because it's a significant issue. It's a significant drain on the people that they have, and
Right,
trying to get it all set up. It's not easy to do. But if it's needed, they're ready to implement that, and I'm ready to help them do that.
okay,
So that's just another thing you may see. I don't know, and it's not gonna be necessarily countywide. You know, if one school sees significant issues, maybe they'll implement it, and another one won't because they're not having that issue.
right.
So it's gonna be individual.
Inside the courthouse here though, do you think we should mandate employees wearing masks or just recommend it?
I would strongly recommend it. As a county, if you would like to mandate it, you can. We have
I
other
think
mitigations going on,
mandates.
but I'll tell you right now, the people that are coming up positive, they're not getting it here.
Yeah.
Right,
And if you shut down the courthouse, that's been a question that I've
Yep,
received.
again.
If you shut the courthouse down to break the cycle, that's not going to work.
right,
Because the only way to break the cycle is for everybody to stay at home for like a month, period. That doesn't, you're not gonna
It's
do that.
impossible to
yeah,
do.
No.
that's not gonna happen.
So if you shut the courthouse down for even 2 weeks, they're not going to stay home. People are going to go out and do things. They're going to get groceries.
Mhm.
And then they're going to come back and it's gonna start all over again. So that's not a solution.
So I think you should get your clerk to send that to all department heads.
Right.
Saying that the health department strongly recommends.
Right,
But does not mandate that all employees wear masks.
Well,
or
right,
what
'cause
they
you've
have.
Now, I will say what we do in the health department, we cohort, we're pretty far apart, we have our own offices.
right,
We wear a mask if we have somebody come in.
right,
We put on a mask, we prefer that they have one, but it's, as long as I got one on.
well, I'm thinking like this office, Mindy sits clear back in the corner,
Yeah,
and she probably doesn't deal with the public much,
right. So
so,
for them to sit here all day and wear a mask is not good. It's not good for your
Right.
health, it's not good for your psychology, and
Yeah.
it's hard, and I'll get out. I'm already sweating, just so you
yeah.
know.
I know,
And if you have glasses, that's a whole nother
Yes.
level of.
try driving the school bus at night and wearing a mask.
It's not fun.
They fog up your glasses.
But I think it's appropriate we do
Yes.
send it to all department heads.
Yes.
Saying something that
But,
the health department has recommended that when you cannot be
Right.
socially distanced, even from your fellow coworkers,
right,
But you don't
to
have
put
to
your
have it all.
mask on.
For instance, I take my mask down, you know what?
Yep.
I'm okay.
yes,
It's okay.
yes,
And then I'm gonna put my mask.
Put it back.
Yeah. Right.
It's the people that are just like, oh my God, you did that.
yeah,
It's okay, people. And you know what? Everybody is eventually going to get this. It's like the flu.
Yes,
The best we can do is do what we can to protect ourselves and everybody else, and try and tamp it down a little bit. But you're not gonna stop it.
Well,
And as it gets bigger, it's just gonna grow exponentially.
another thing, we had a family member that just had it, and they were up at the hospital, and they were not fully recovered yet, but they said the hallways were lined with people that were sick in chairs with plexiglass between them.
right,
And they said they sat there for hours
yeah,
until they finally, they go, you know what, and then they're like, you gotta leave, we know you're not 100%, but we
Right.
someone's sicker than you.
They're discharging people on a
We need
triage
to-
basis
we're trying
right
not to
now.
Right.
overwhelm them and slow that down.
Same thing goes with testing. Testing is getting a little harder to get. If you don't have symptoms, they're not going to test you
Right.
right now. Even if you've had a solid exposure in your family, if you don't have symptoms, they're not going to test you. If you start having symptoms, you can try. But I can tell you right now, the wait times just on the Stormont Vale hotline for COVID is up to an hour, sometimes more, just to
Right.
wait to talk to somebody to get a scheduled time to go get a test.
right,
So just keep that in mind. And it's not that you can't get tested, it's just that you need to be patient and they're going to triage you a little bit because they
Right.
have to. So,
Are they treating anybody with therapeutics yet, or is it just they go home and?
define therapeutics.
Well, with some of the new stuff that's
Some of
been
them,
in the
yes.
works, like the remdesivir and any of that, or prednisone and.
Some of them they are, but I don't know specifically, since I'm not in the hospital, exactly what their regimen is. And I don't know their capacity yet. I know they were divvying it out there at the beginning, but I also know that have been able to increase their amounts.
I just didn't know if they're treating anybody at home without admitting them first. If they're saying, oh, if you have this, here's some things you can, we'll
Some
prescribe
they
for you
are.
at home.
And it depends on their symptoms. For example, we've had reports of a lot of people having clots, which is dangerous, of course, because it can go to your lungs and then, you die. So they're being sent home with medication to prevent that. So there's different things, not just specifically for the virus itself, but for side effects of it, that they're being sent home
Well,
with.
that should help, because I think that's fairly new in the last few weeks.
A lot of oxygen, obviously, although, I mean, jury's out on how helpful that is. But, different things like that.
I got some questions.
Yes, sir.
Okay. As I stated in public comment here, I am on the list to know about new vaccines. Okay, the one that we already knew about last week, but I didn't get to say about that because they were taking their time with this canvassing the vote. That one is 90 degrees below zero. Do you have that capability to get that particular vaccine and you have that low a temperature?
Not right now, that's dry ice.
I thought dry ice was 60 below zero.
Whatever it is, no, we
Okay.
don't.
You know. Okay, now then the second one, it just came out early this morning.
Mhm.
It don't have to require a maximum of temperature.
Mhm.
Yes, and it's 95% effective.
Mhm.
So when are you going to get to know how we're gonna get this vaccines that Trump is trying to get to us?
I mean, that's a really good question. We don't have a date. There's a lot that goes into that I don't have anything to do with. And like I said before, it's not as simple as the virus is there, or the vaccine is there, and we just get it. There's a state plan that says, once we get it, here's who gets it first, here's who gets it next, and that has to do with how much we even get as a state. And then it's how it's distributed. And it's not just the public health departments that are gonna get it, if we even get it. They're looking at, CVS and Walgreens, and it may not even be available to the public for some time. Because like I said, they're going to have certain populations that'll get it first. Long-term care is a big one. So frontline workers, long-term care, and then you'll start looking at sections of the public. So nothing's changed.
Now, I do know individuals that live in this town right now. They didn't get it like you're saying. They have to work outside the county. When they go outside the county and work in another establishment, and they work with people, whether it's inside or outside, and they get the people there get it, then that puts them in quarantine, which are a number of them here in town in quarantine just for that reason right now.
Because
So-
we're exposed.
That's exposed.
Okay.
So, that you're gonna know about that, if that person gets the virus in here.
If it's the virus and it's reported to the system, then yes, we know about it. But if it is not reported in our system, we don't know about it. And that is worldwide. That's United States. I mean, it's not perfect and it's not going to be. You're not going to be able to get all of that stuff in there exactly right. We still get people that are reported as ours and they're not. They're for another county. So I guess I don't really understand what your question is.
Well, what I'm saying is, because it's not treated that way. See, kids ain't getting it.
What do you mean it's not that way? I'm
Well-
just trying to understand.
Well, okay, but see here, some of these work at a different locale, and they have to go with those individuals to do their jobs.
Right,
Now, if they're sick, then that's how they got it,
right,
and that's how they where it had to be quarantined.
right.
Okay. That's what I'm saying.
Is there a problem with that?
No, but I'm
Oh,
just
okay.
telling you, I mean, that's going on
Yeah.
too.
Yeah,
And
you
then the
know,
ones like you wear a mask.
it's been going on
They're,
for,
but some of them that wear masks are getting carbon monoxide poisoning. And now they're in a hospital also.
They're not getting carbon monoxide poisoning, Gene. That's a product of combustion.
Well,
Carbon
like I said,
dioxide is a little different.
whatever you get by keeping a mask on, then that's what's happening too.
That doesn't really have any bearing on what we're doing, but.
Okay, fine.
Okay.
Yeah, I'm just
So-
telling you, you know.
Do you need to make a recommendation for the county for
Nothing
businesses or?
nothing that needs, any kind of orders or anything
know.
like that. I mean, just what we said earlier
guess
is,
we just-
is where I stand.
Kind of put a reminder in the newspaper that, you
Yeah,
know,
we'll
the
work with
public,
the newspaper, we'll put it out on Facebook,
You know, that-
just what we can do.
you tell people to use their head.
Sometimes
Common
it's hard,
sense.
not gonna lie.
Oh, right, so,
Thank you again.
Okay.
And your entire department, I can't, from all of us,
Appreciate it.
thank you enough for all that you guys are doing
Okay.
for all of us. Thank you, thank you, thank you.
Let us know if you have questions, we'll do our best.
okay, thank you.
All right.
Coming in.
Yep.
Anything else, Tina?
We've exhausted the agenda. Yes,
I move we adjourn.
a second.
Uh,
been moved and seconded, we adjourn, all in favor?
Aye.
Aye. We are adjourned.